if you had several people have hip surgery and they're all in rehab at the same time, do you think that one person who's successful at getting better, that it's really the best thing for them to go around to all the other people who are still perhaps in wheelchairs and say, you just suck? Like, you just aren't trying hard. I am up, like, I'm walking around. What's your problem? Right? People's bodies react differently to different things. People's physiology are different. People's genetic predisposition for any given disease are completely different. So you could both have the same problem and have an incredibly different set of needs and responses to a plan to try to address that problem. And that's true for fighting cancer. That's true for fighting diabetes. That's true for heart disease. There are some patients who have heart disease and they need this treatment, and some need something completely different. And that's why treatment is customized to the patient, right? We can't just make it all one thing for everybody. And unfortunately, treatment to now, that's what it's been. It's been all the same thing for everybody. When you go into treatment today and you sit in that circle working 12 steps, you could be next to somebody who's got a cocaine use disorder, a methamphetamine use disorder, an alcohol use disorder, a sex disorder. They're all in the same group doing the same thing. And they're all very different disorders. And then on top of that, they're all very different people. You know, a mom with young children and the stressor she has are going through something different than, you know, a veteran with the trauma that they've endured and the exposure to alcohol they had as they were active duty service members. They're just different experiences. And we have to acknowledge that, make room for that, and honor your path. If your path was successful, wonderful. It's outstanding that you were able to achieve this. And everyone, I'm sure, is really proud of what you've accomplished. It's not easy to do what you did, but it doesn't mean that your way is the only way for everyone. And there are people who are far enough along in this illness that their brain is no longer functioning well and they need more support. They need medications to enable their brain to calm down enough for them to be able to make the choice to stop using. That's a stage 4 patient, like stage 4 cancer. And when we treat it aggressively. And perhaps you weren't stage 4. If you weren't, that's wonderful. But if someone is, please refrain from the judgment, because it's not helping anyone. It doesn't make them want to do what you did. It just makes them frustrated and feel bad about themselves.